My name is Dr. Changizzadeh. I'm a medical oncologist and hematologist at ECHO. My job involves treating cancer. So people always ask me, what is cancer? Cancer is the abnormal growth and spread of cells. Usually our body makes cells and it grows, but they have certain checkpoints or markers that tell it to stop growing. Sometimes there's a mistake made in the genetic component or a mutation that causes the cells to grow abnormally and get out of hand. At that point, we have what's called cancer. It can happen to anybody at any age, although there are pre-existing conditions that can cause it to get out of hand. An important history is part of our care and part of the initial consultation when a patient comes here. It's important for us to know everything about you, your medical history, your family history, and everything you've had treated before to give us clues into how we can better assess where your disease came from and how we can approach it. Before we get started, we need a tissue biopsy. So that involves getting a sample of the mass, the tumor, or the lymph node. This involves looking at the imaging you had done and finding the right target that we can approach and getting the sample. That sample will be used to get a diagnosis of what type of cancer you have, and further testing can be done on it to see if you have any targets of other treatments that can be used to treat your disease. This is all part of the workup that you get done when you come in here. Cancers are in all different forms. There is what we call liquid cancers, which are leukemias and lymphomas, and there are solid tumors. Everything is treated differently and the approach is all different. However, there are some similarities. For example, before anything is done, we need to stage your cancer. This involves getting imaging of your whole body or the local area to better help us evaluate how to approach it, whether that's the surgical, radiation, or chemotherapy. Different modalities or types of treatment is designed based on what type of cancer you have, where it is, and if you're eligible for that type of treatment. As part of your treatment team, we involved our nurses, other physicians such as surgeons, radiation oncologists, and other specialties that may help us provide the care to you. This is known as your care team. Once your treatment starts, we have to decide what type of treatment you have. Not all treatments are different and not every treatment is for everybody. It's a tailored approach. We treat the person, not just the disease. So it doesn't matter how old you are, but it does matter what physical state you are in, and that will be part of your evaluation. Nobody is ruled out. Everybody's given the appropriate attention, care, and all options are presented to them. A lot of times your case will be presented in a committee, what we call a tumor board, to get everybody else's perspective, such as other specialties, other oncologists, even in other practices, to get a better review of the imaging and the pathology so we can further assist you. Once you begin, you will be given supportive care in terms of medications, such as things to control nausea, vomiting, things to support your blood counts, which will be monitored at every point during your treatment. And you'll be seen consistently to make sure those levels meet the parameters for your treatment. Your toxicities and side effects will be monitored at every point, and your treatments, if it's chemotherapy, immunotherapy, or otherwise, will be monitored and adjusted. This is a very difficult time that you're going through, and we'll be with you through the whole course. When treating this difficult disease, it's important to know that all hands are on deck. We work with all your medical providers, and every treatment is different. But at the end, you'll be getting the optimal care that you deserve. We welcome you to our ECHO family, and if there's ever any questions, all of our physicians, nurse practitioners, and providers will always assist you and inform you before you begin on this journey with us.